Hello, everyone. Good afternoon, and welcome to Wellness Watch. This is an opportunity for all of you who are viewing now live with us and those who may watch this video at some point in the future to be reminded of some very, very important things that you and your family and friends need to do to keep your Medicaid, also known as SoonerCare in Oklahoma, that health insurance coverage. I am so happy to have you with us today. I'm also extremely happy to have a colleague. We share the same birthday. She's rather famous in the Shawnee area and around the state for her stage presence. She's most notable at Oklahoma Policy for her smarts and intellect regarding taxes and healthcare, Miss Emma Morris. Emma is our policy analyst. Hi, Emma. Who does focus on tax issues, but also on health care. Welcome, Emma. We're glad you're here today.
Thank you, Angela. I'm happy to be here with you.
Well, I appreciate that. We'll get a chance to hear from Emma a little bit later when we have a brief conversation kind of about the history that got us where we are today. As many of you know, Oklahoma did expand Medicaid a few years ago. We took in some 300,000 new individuals who were newly eligible. And some may have been eligible prior to, just didn't know it, into our SoonerCare program. And then, of course, COVID hits and things get locked down of sorts. And Medicaid, more importantly, the eligibility for Medicaid was put on hold. And we'll talk about now that eligibility process has restarted again, what that means to a whole lot of Oklahoma families. So I'm just going to encourage you all who are watching and listening today to call your friends, call your neighbors, even call the people who you may not like. But this is a really important conversation. It'll live forever in Facebook and on our YouTube channel, so you can share it and look at it again multiple times. But we want you to watch live today and call your friends and family members to do so, because during the course of the 2 hours that we're going to be together from 2 to 4, not only will we have conversations live across the state with individuals who are involved in helping folk re-enroll and renew their Medicaid eligibility, but we're also going to give out some gift cards, $25 here or there, $50 here or there. And if my boss doesn't call me and say, you can't do that, we may even give out one big old $100 gift card to the lucky viewer. But you got to be watching because you have to comment. So if you're watching live right now on Facebook or YouTube or wherever, however you're watching, just shoot us a comment. Tell us your name, where you live, and some random individuals who are watching. Your name may be the one chosen to receive a gift card that will buy at least a quarter of a tank of gas nowadays, huh, Emma? Things are quite expensive. So again, thank you all for being present with us. Emma, you got anything that you want to add about today before we go to our first live spot?
Sure. I'm really happy and excited to see all the work that the folks we're going to be showcasing today are doing. I know sometimes that SoonerCare can become confusing for a lot of folks, for me, and it's my job to understand it. So I hope that all of our people watching today are able to get some questions answered. Tell us if you have questions in the chat, so we can talk through some of those and make sure that everybody can keep their coverage.
That's right. That's what today is about. Thank you, Emma. As I mentioned earlier, we have partners across the state who've been helping us for some years improve the health and the well-being of Oklahomans across the state. These individuals helped when we expanded Medicaid to enroll people, individuals who, for instance, adults with no children who were between the ages of 18 and 64 became eligible for Medicaid. The only criteria really put in place was income criteria. The Affordable Health Care Act had to become law, in essence, is now constitutional in Oklahoma because of State Question 802. Now, many of these same organizations are still working with us to make sure folk can keep that coverage we work so hard to get. And I want to bring into the studio with us a really important organization in Lawton, Oklahoma. It's called the Great Plains Improvement Foundation. It's a community action agency that services multiple counties. I'm not really sure when they join us in studio. Our dear friend Glenda Parrish will be joining with us. She'll give us an opportunity to learn more about the Great Plains Improvement Foundation. And because I don't see her, that would suggest to me that maybe she's not ready to come live with us. There she is. Hi, Cheryl.
Hey,
How
Angela, and
are
it's
you?
Cheryl Gregory with Great
What did I
Plains
say?
Improvement
Glenda
Foundation.
Perry.
You said Glenda.
I know,
But this
forgive
is,
me. I know your name, how well.
that's okay.
Glenda is one of our other partners. You know that. And I probably had called you
Yes,
Cheryl.
ma'am.
I've called Cheryl Glenda more than once. Just like I have a team member
Yes,
named
ma'am.
Austin, I frequently call Cole. There's another Cole who I'll call Austin, but just charge it to this old brain. I love you dearly. Cheryl Gregory. Cheryl is the executive director of the Great Plains Improvement Foundation in Lawton, Oklahoma. And they've got a big event going on. So let me stop, Cheryl, and first ask you, tell us a little more about Great Plains. What do you do? What services do you offer? And to who? I know it's the
Well,
Lawton County, Comanche
yes.
County, maybe other places.
Comanche. Yes, ma'am. We're Great Plains Improvement Foundation, community action agency here located in Lawton, Oklahoma. Our federally funded service area is Comanche County. However, we do provide services in other counties, such as our child support services. They service both Comanche and Cotton County. We have a child care food program where she travels across the state to help out our daycare providers and make sure they're feeding our babies nutritious meals. We also operate the Sea Cotter Crane Homeless Shelter, which is located right here in Lawton. But people come in from all over the state to come to our shelter if we have space. We also are revamping our RX Oklahoma program. So we're super excited about that. That's tying into our big event today. We are so excited to have this event and to be on live with everyone. Thank you all for having us. Thank you for the partnership, Angela, with Oklahoma Policy Institute. And we're just glad to be here. I want to take you out now into our lobby area.
Before you
We
do
have some.
that, hold tight.
Okay.
Cheryl,
Okay.
before you do
I'm
that, let's
I'm
talk
too
a little
excited.
more. Okay, I know
Okay.
you're excited, but I want to ask you a quick question because
Yes.
you guys were one of our original partners when we expanded Medicaid.
Yes, ma'am.
Um, so, talk to us just a minute about why it was so important for Great Plains Improvement Foundation to be involved in making sure that all those folk who are eligible for Medicaid signed up back in July of 2020, I think it
20,
was.
yeah, because it was pre-COVID. Yes, ma'am. Well, it was very important to us as a community action agency because it ties right into our mission of helping people and helping themselves to get, better opportunities. And especially when it comes to healthcare, when the Affordable Health Care Act came down, that was a difficult time because at that time, Oklahoma did not become a part of the marketplace, or we didn't create our own state exchange. So that made it a little bit harder for those who were dropped from some of the other roles that the state offered, for them to get health coverage. So we were already doing the RX Oklahoma program where we help individuals who are underinsured or uninsured to get their prescription medications. This tied right into what we were already doing. So back in the day when the Affordable Care Act came about, I was a navigator. I trained to be a navigator with that. So we were helping people get enrolled through Healthcare.gov, just bringing awareness to other methods of people to get health insurance. It's just so important that people understand that they can get coverage,
That's,
and people need it, and we need it in our state.
that's
So
absolutely
we have continued to do the work. We're excited to bring RX Oklahoma back. We were stagnant for a little bit, for a few months last year, but we are ready to ramp it back up again. And we got a great day planned, not only with RX Oklahoma, but to bring awareness to Medicaid expansion,
right.
to Medicare, and to celebrate Breast Cancer Awareness Month.
Yay! That is absolutely right. So, what a perfect time to talk about wellness and health and well being. I'm not going to jump the
Yes.
gun because we may stop by the RX station so you can tell us
Okay.
more there. I know you've got a kind of a mini health fair. Maybe it's a big health fair going on right now.
Yeah.
So, thanks for walking us through. And I'm just kind of stretching a bit till we get to your first stop so you can tell us what's going on.
Hey, are
All
you
right.
on there and you on there?
Okay. Yep. I'm right here.
Are we ready?
Yes.
All right, come on, Jackie, you go first.
So we got an event going on, folks, as you all can see. If you all can gather in and come on in the camera. Come on, everybody up. Come on, let's show everybody what we're doing. Yeah, we having a little dart contest over here where if they throw the if they hit the balloons that are over in the corner over here, if they hit those balloons, they'll be able to get a prize right over here on the table. We got a whole bunch of prizes set up for anybody that is able to strike that balloon. So we just got all types of goodies going up. We got the first person get ready to throw. Hit it, Jackie.
Oh, yay. That's great. Jackie
So,
gonna see this back. She's
so
gonna be
Jackie
famous now.
popped that balloon. So now she's headed to the gift table to pick out a wonderful gift for
Wow,
joining us today.
that's a
So look
lot
at
of
all
stuff.
this neat stuff we have. We got all kinds of stuff. We got Santa slippers over here. Okay, let's see what she got. Come on, Jackie, let's see what you got. All
We're getting
right.
ready for
You can even
Thanksgiving.
put
That
your
looks like
phone up there. Look at there.
Thanksgiving.
Oh,
Yeah.
yeah. Congratulations, Jackie.
So I expect Cheryl,
Yes.
both doing this activity, that's kind of stay healthy, right? Get up, move, do something, right?
Yes. As we promoting Breast Cancer Awareness Month, as well as the Medicare expansion, so we have tables set up to showcase, what we can offer and help people with. There's our SoonerCare for Medicaid, so they know they can, come into us to get the help
Right,
that they need to
great,
sign up for SoonerCare.
right.
Of course, we got treats. Always have treats,
I
right?
gotta have treats, gotta have food.
Wait a minute. We got another contestant. There's Miss
All
Melinda.
right.
She's getting ready to shoot to hit that balloon. Come on, Melinda. You can do it. Woo! Oh, she didn't hit it. Try again, girl. Try again.
Get up and move. Get up and move.
Up. Come
Uh-oh.
on, lady. Come on.
Your little,
You got it. You got to do better. Come on. We got it.
community action agency is so important. I'm sorry. I wish I could be there to help. Step a little closer,
Well,
maybe.
you still gonna get a prize.
All right.
Hey,
So
can we
We'll
get
give
prizes?
this to
Help
somebody
hit it?
else.
yes, my tickets.
Yeah.
All
So we're just
right.
having a good time here at
That sounds like that
GPIF.
looks like a whole lot of fun. Cheryl, tell us a little more
Right,
about the
right at the
RX
end of
program.
that, right there.
Yes, RX Oklahoma, right here. RX Oklahoma.
Right.
RX Oklahoma is the program that helps those who are uninsured or underinsured to get help with their prescription medications. That's a very important program for those who, the one requirement is that they must have their own doctor, have a physician, of course. And we help them with their maintenance medications, any type of medication such as high blood pressure, diabetes, asthma, cholesterol. We work towards helping individuals to get the medications that they need. We work with pharmaceutical companies as well to keep it at a low cost or no cost to the client.
Let me ask you, do you have to meet an income eligibility level to do RX or just have the prescription and not have insurance?
Yes, that is the main requirement is that they first must have a doctor and they must it must be a maintenance medication again, or they must be either uninsured or underinsured.
Okay.
So
All
income is not necessarily, income is, we look at the income, but it's not a main requirement.
Okay. All right. That's good because a lot of times people have some folks might think a reasonable income, but still really can't afford to take medication. Somebody won. I guess you got another winner in the house.
Yeah, we got another winner in the
You
house.
got another winner
We
in the
do.
house.
We
Um,
do.
Well, sure, all of this sounds like such a wonderful opportunity for people. Great Plains, I know, is just a focal point for the folk in Comanche County for a whole lot of things. This whole day is about, not just signing up for Medicaid, SoonerCare, renewing your SoonerCare, but it is really, like you said, this is Breast Cancer Month. This is an opportunity to really get some thought to being well. and healthy and whole.
You want a heavier one?
Exactly. Exactly.
Really think about how policies are important to make sure that people have access to the care they need. A whole lot of folks work really hard to get state question 802 passed. That was the question that made our Medicaid
Okay, how many
constitutional in
more
Oklahoma.
chins
We're one
you
of the few
got? It
states.
doesn't
It's
matter.
not just a state law. It is a part of our constitution. And we work really hard to get that done. So we definitely want to make sure that people don't lose their coverage simply because they forgot. Now you muted yourself, Cheryl. Come on back in here with me. There you
Okay,
go.
sorry. Hold on,
No,
hold
no,
on.
no, no, no. That's okay.
I was
Let's turn around
messing
and
with the
see
phone, and I
your
was
face.
like, I got myself. Okay, I'm back. Okay,
That's okay. Come on back with me so we can see your face. We have a couple more minutes,
okay.
and
Let
I
me
just
let me
want
put
to talk
myself
to you
back
a
on.
little
Here I
more.
am.
There
Okay,
you go.
there I am. Okay.
I just want to talk to you a little more about why you do this work
Yes.
and
Well,
why Great Plains it really is important to from the heart. What does this mean to you?
well, I've been in this profession for 20 years. And when I first came to community action in my family, we weren't in the best of circumstances. So, because of that, that's why I love the work that we do, because not only did community action change my life and improve my life, but I also get the opportunity to do the same for others every single day. I just can't even believe it myself that I've been here 20 years, but all the work that I see our agency do and the lives that we touch and the lives that we change, it makes a difference. And so that's why I stay with the work. The people that we work with are great people. They're humble individuals, and they know that our people need the help. And so
That's
they
right.
have been dedicated. We have committed staff here, and it's just been great. It's been a great ride.
Well, I can't even believe that you've been there 20 years because
Yeah.
I just thought you were about 22 years old or something like that. Not hardly. So tell us, where's Great Plains located? Uh-oh, Cheryl froze for me. Uh, well,
A
I was going
long
to
time.
ask. Okay, there you go. Thank you. You came back
Yes.
to
Okay.
tell us where Great Plains Improvement Foundation is located. Give us a street address, some hours of operation, all that kind of
Sure.
stuff.
Sure. Our agency is open Monday through Friday from 8 to 5. We're located at number 2 Southeast Lee Boulevard, Suite 100, right here in Lawton, Oklahoma.
And that's a new address for you, right? New
Well,
location.
it is quote unquote. We were upstairs in this building, but now we've moved downstairs. So we're still in the
Same
same location.
building.
We just changed floors. That's okay. That's
Okay,
all.
that's good. Makes it a little more accessible to folk, I
Yes.
guess. So,
Yes.
well, I just simply want to say thank you. Thank you, Cheryl Gregory, because you have been a trooper
Yes.
in just
Thank
fighting
you.
to make sure that every person in Oklahoma has an opportunity to stay well and to stay healthy. And not just through SoonerCare and the Medicaid expansion in Oklahoma, but like your focus today on breast cancer and the RX program and making
Yes.
sure that people have. I know you guys, you won't talk about it, but if a person walked in with housing and food needs and all those basic human needs, I know Great Plains is ready to help. So for that, I just
Yes.
personally want to say thank you.
Yes. And if we can't, we can certainly point them in the right direction. We have great
All right.
partnerships out here as well.
That sounds like a winner. Let me say to you, Miss Cheryl Gregory, my good friend, I'll be in Lawton soon. Thank you for joining us today. And if you're out there listening and you live in Lawton, Oklahoma, stop by Great Plains. Go
Come
by
on
there.
and see us.
Come see us. If you need some help renewing your Medicaid, your SoonerCare eligibility, go by. If you need some help with your RX, your prescription, go by. If you want more
Hmm.
information about what it means to and how you access screening and care for breast cancer, go by and see Cheryl and her wonderful staff at Great Plains Improvement Foundation.
Hi,
There's
everybody. Hi,
Yes.
Cheryl.
Me and
everybody.
Myra will be glad to help you.
All right, Myra, it's good to see you and thank you for all you do. Myra's been working in Medicare, open enrollment. Now she's doing Medicaid.
RX.
She RX program. She knows a whole bunch of stuff. So guys, if you're watching now or even later in the future, if you're in the Comanche County area, make a stop by Great Plains, one of the best organizations that Oklahoma has to offer. Thank you both very much. I love you so.
We love you too. Thank you.
Love you.
Bye. All right. I just love my folk in Lawton. Thank you guys very much. Emma, come on back with me. Have you ever met Cheryl and that crew before?
Only on Zoom, as is so often the case these days. I've not gotten to meet them in person.
I'm going to have to take you with me to Lawton. Emma, for those of you who may be watching who don't know Emma Morris, again, I said we share the same birthday. I'm proud of that. I wish I could say we shared the same birth year, but technically I could be her grandma. So Emma's really one of the smartest and nicest people I know. And I just wish everybody in Oklahoma, Emma, had an opportunity to get you to know you like I do. But she does know Medicaid. And again, just going to promo this because later on in the program, Emma and I are going to have a quick conversation about Medicaid policy, SoonerCare policy in Oklahoma. What changed 3 years ago? What happened when COVID hit? Why are we at this point right now? Now, just as a little hint, there are of all those people that enrolled and people who were already in Medicaid 3 years ago, once COVID was over, the pandemic was over, and we started disenrolling people, unwinding, those are terms you'll hear us talk about. Right now, about 160 people have lost their coverage, is the number I see. I don't know if that's correct. Emma, you can fix that. If it's not, you can talk to us about it. The key is we don't want anybody in this state, right, who has Medicaid coverage, who has SoonerCare coverage, to lose it simply because they did not renew their benefits. And we know folk are at risk, right?
Yeah, that's right. So I think you said 160. I do want to ensure that people know it's actually about 160,000 people who have lost coverage.
160,000.
Right. Which is a big difference. That is based on data that's thankfully published publicly by our Medicaid agency, the Healthcare Authority. I do want to say a lot of states aren't publishing that kind of data, so it's really great that the Healthcare Authority is being really transparent with that. And yeah, that being said, there are still a lot of folks who are at risk of potentially losing coverage, which I think you said we're going to talk a little bit more in depth later. But yeah, it's just really, I think we're about halfway through the unwinding process. And so we want to make sure that no one's losing coverage unnecessarily. And if people are no longer eligible for SoonerCare, that they're getting transitioned to other forms of coverage, like maybe through an employer or through the federal healthcare marketplace. We just want to make sure folks are connected and getting their families connected to coverage that meets their needs.
That's absolutely right. Thanks for saying that. And we'll reinforce that same message over and over and over today. Guys looking and listening to this, you know, repetition is good for the soul. And in this case, repetition is good for the body. Because people need health care services to stay well. And, you know, the folk who really know a lot about the necessity of having coverage and accessing care are the practitioners, those people who see people in clinics, whether they're administrators, whether they're social workers, therapists, whether they're nurse practitioners, RNs, LPNs, physicians, PAs, it doesn't matter, but the people who care for those of us who need health care access really understand the importance. So our next two live spots, Emma, are to a couple of locations that provide services to individuals who need health care. There's an organization called Guiding Right in the state of Oklahoma, both in Oklahoma City and Tulsa. And Guiding Right, I'm not going to steal their thunder, but they offer a full array of services to some targeted population groups, but then in some of their clinics are open to folk who need it. So Maya, if you're listening, we're going to bring Maya in. Maya is
good afternoon.
Maya is with the New Hope Wellness Center here in Oklahoma City. It's a Guiding Right clinic. Maya,
Guiding Right, yes, and we are at New Hope Wellness Center.
Tell the people watching and listening what Guiding Right does.
Guiding Right,
what New Hope Wellness Center does.
Well, I am located at New Hope Wellness Center. We are the clinic umbrella under Guiding Right, and what we offer is no-cost screening, HIV, Hep C, gonorrhea, chlamydia, and syphilis. You may need some additional test, STI, STD test administered, but it's something we can discuss with our nurse practitioner. We also offer the HIV and STI treatment. We also provide PrEP and PEP for clients. We do take walk-ins, and for the uninsured and insured, patients are accepted.
So PrEP and PEP. I explain what that means a little more.
PrEP would be for if a person knowingly was maybe exposed to someone prior to getting HIV, and PEP would be after, post and pre and post.
Pre and post. Gotcha.
If you remember that in school, the pre, before, the post, the after.
After
and this
we
is
got
for the exposure of HIV.
Good. So where is the New Hope Wellness Center located? We
are located in Oklahoma City. If people have landmarks, we're not too far from Penn Square Mall, but we're off of 31st and May. Our address is 2809 Northwest 31st Street in Oklahoma City, and that zip is 73112.
All right. It's really centrally located.
Yes.
Easy access from virtually every highway around. I've actually been to the clinic. I know that when COVID was raging, you guys were also offering COVID tests there at the clinic.
And we still are. And we do administer those at all locations. Our headquarters is on 23rd Street, 1420 Northeast 23rd Street. That's our Guiding Right headquarters. I just so happen to be housed here at New Hope Wellness Center. So, yes, ma'am.
Can people get pre and post, PrEP and PEP and PrEP services at the 23rd Street location?
No, just at the clinic here. Just here at the clinic. And they'll be more than happy to tell you, come on to the clinic, to reach out to us, call us, email us, some type of way. Someone knows us here.
Okay, that's great.
Yes,
so just talk to us. I know you see patients who have real, I don't want to say particular, but who have these chronic, if that's not correct, correct me, but these chronic conditions, these health concerns that really can compromise a person's well-being if not treated, and the need for other kinds of services, I would imagine, really manifest sometimes in the population that you see. So talk to us just a second about why it is important for people to have health coverage and access to healthcare services beyond maybe even what you offer there at the New Hope Wellness Center. Why is this important to not just your population, but others?
Well, it's important first and foremost to know your status. Regardless of if you had a test done last year, to get your test done again. Of course, we do the free screening for HIV, Hep C, gonorrhea, chlamydia, and syphilis, but it's also highly important to have insurance. We have individuals that come and have lost their coverage, and it takes something as a simple call of just calling SoonerCare, the helpline. Maybe they're just needing the PIN just to get them through the website to make sure all their information is important. I had a few clients come in and have that issue, and they just didn't have that information. So we're the type of place that provides the information. And that's one of the roles that I have here as clinical case manager, the resource, the advocate, the spokesperson, to give the information when they don't have it. I have it on hand for them, and it'd be just as simple as a phone call. And treatment. We are here for treatment at this location, which we are. New Hope Wellness Center is umbrellaed under Guiding Right. And I just appreciate Theo giving me the opportunity to be housed here and given the type of services needed for the clients that are in need, such as SoonerCare, or just having the free testing done. I just like to give the word out in regards to what we offered here. And a lot of the times when we get clients that come in, they've heard about our place of business through word of mouth. We do have a social media page, and we try to reach out to different events, doing tabling events. We even have a mobile unit that we do our testing on site sometimes. So just depending on where we're located, we may have material out and about. I usually carry that with me when I'm going carrying a business card or whatnot. But we're here for whomever needs testing. Like I said, we're located here off of 31st and May, right past. There is a corner of 36th and May. There is an on-queue on the corner and a Wendy's on the other side.
And my grandbaby loves those
You're
fish
just going
fries.
to come down a few blocks and you'll turn left or right, just whichever direction. We're here. We have our big sign in the front. We're here to help anybody that walks through our doors.
Let me ask you another question, Maya, about a population, because I don't think we talk enough about STIs, STDs anymore, and people who I know even young people may not even know what that means or what that is. When I grew up in the 70s, 60s and 70s, you know, syphilis and gonorrhea, I mean, scared everybody.
Yes.
And it seemed like we were able to control it to some extent. And then recently, I know the numbers have increased fairly substantially with the transmission of sexually transmitted diseases or infections or whatever the STI is. Can you talk about a little more about what you're seeing at the clinic or what you know about the numbers?
The numbers, I don't want to, I don't know the exact numbers, but I do know that our African-American women are the highest to be infected with HIV here in the state of Oklahoma. And we do have a program called Link Positively. And if anybody wants to reach out to me, I can give you more information where I am just there for support and to give the resources available for anybody that's in need of any resources. And we also use our community partners, but we do our Black and our brown. That's who we kind of target because that number is so high, but we see everybody. But I'm glad to have the opportunity to be able to be on board with you today and then just speak on what we offer. And like I said, it's free. We take the insured, uninsured, but that community is what we're focused on because it's the numbers are so high here in Oklahoma. And a lot of people do not know where to go to have tests done, to know where to go for food pantry or housing or what's available for them. So that's where we're coming. Our case managers come and play for that. But like I said, we have our locations across the state of Oklahoma. I just happen to be one of them. And I'm just glad to be on board to help whatever I can help with, even if it is signing up for insurance, just giving them the number and then them getting the insurance number or card, whatever they may be given, that just, they don't go leaving the same way they came in our door.
That's right. Because that card or that number with SoonerCare doesn't just get them access there, which they have anyway, but it gets them access to every provider in the state of Oklahoma, which is really critical to know. You know, I'm glad you talked about women and Black and brown women, because not only are we at the top of the list when it comes to things like exposure to and infection rates for sexually transmitted diseases, we still remain some of the most unhealthy on virtually every health indicator. And so it really is important for us at OK Policy and our partners to target our work with those who are most vulnerable, those who are in greatest need. So I'm glad you mentioned that because that's an audience that sometimes gets bypassed when it probably is an audience that we really should be spending a whole lot of extra time and energy trying to access. So thank you for mentioning that. That's significant. And thanks for mentioning, stay with me, don't go anywhere. Thanks for mentioning the fact that you are one of several locations that Guiding Right offers. And I know one of your, I was going to say partners in crime, but partners in making life better for a whole lot of Oklahomans is there in Tulsa. So Michael is here too with us. I don't know how often you and Michael get a chance to see one another, other than on these little
turnpike
down that turnpike. But I just want to before you leave, Maya, welcome Michael Merriman. Michael is at the Tulsa Guiding Right office. So I wanted you to have a chance to stay with us.
No problem.
As we visit with Michael just a little bit. Michael, talk to us about what you do in Tulsa.
Yeah. Can y'all hear me okay?
We can.
Okay, good. I had to make sure that was in question earlier. So what we do in Tulsa is we're largely an outreach facility. So what that means is we will take the backup for the Department of Health, Tulsa Health Department. If they've got an overflow, we're happy to take that. We partner up with them. We also we do collaborations with TCC, Tulsa Health Department, and OSDH for PrEP. Also, the Take Control Initiative. We have Plan B here for individuals, and also too some pregnancy testing kits that we offer for free for anyone. We focus on testing and screening. So we'll test for HIV, syphilis, hepatitis C, chlamydia, and gonorrhea, but we'll screen for everything. We also do education out in the area with Tulsa Community College. We are out there twice a year. We do testing events with them twice a year as well. Local churches, we actually have had an opportunity to do some education in Tulsa with churches. Also youth shelters as well. In fact, I just taught a class today at the Calm Center that is under the umbrella of counseling and recovery. And so with some of those kids, we talk about what they need to know about the hugging and kissing and what comes with that sometimes. So we do a lot here in the Tulsa area. We do not offer treatments, but we do work with the health department for treatments. So if we have a positive result for, let's say, something that can be treated, we send that on down to, we send them with the results to the Tulsa Health Department. And for $20, they get what they need.
Well, you mentioned another, I think, a very vulnerable population group, and that's young people.
Young people.
College students, high school students. Michael, so what do you know? Just, I mean, that's my opinion because I have a couple of teenage grandbabies, and I'd like to think I'm young enough to hang around kids, and sometimes they just simply don't know things.
No, they don't. No. So many times people 15 to about, I would say 15 to 24 largely is going to be hardest hit for STIs. That's something that's not a secret in our field. And so we know that there has to be focus on that. A lot of folks that I go out and talk to, like today, my focus is on oral sex and the risks that come with that. A lot of people are only thinking about what they can catch down there. They're not thinking, and they're also they're considering maybe pregnancy. They're worried about those things, but they're not worried about what we see in our clinic or our clinics out there with exposures to STIs in the throat, in the mouth, and things like that. So we bring stories and we tell them about what to do and things to watch out for and where to go if things get dicey.
Maya, how about here in Oklahoma City? Do you see a group of young people wandering through your clinic?
No, we don't. We do have some that come in wanting information. And once they do ask for the information, we do provide that. But we haven't had any really young for the age group he mentioned, under 18, I should say.
A long time ago, a really long time ago in the 80s, I had an opportunity to office at a community-based clinic. It was simply Variety Care now. It's now got a new name and it's big, but it's just a small clinic over on the south side of Oklahoma City on Robinson. And I'll never forget the young lady who walked in, 14 years old, pregnant. And I was just really concerned and a bit surprised until I had a conversation with the practitioner there who informed me this is not necessarily as unusual as I thought it was. So for people who might think that kids are not being sex reactive and we just say wait and say no and all of those kinds of things, Michael, that's probably not what's happening, right, Michael?
No, it's not. I mean, realistically, these kids, especially those in youth shelters or in alternative schools where I like to frequent, there will be kids that are really doing things out there. They're the ones that are street savvy. They're also the ones that are probably engaging in illicit things as well, but also having sex. And so they need that information. They actually, surprisingly, they want that information. They have questions about their bodies. Many times in my classes, they'll go, well, this is happening. Is this normal? Things like that. So it opens up more conversations about health and things to watch out for. And so I get a good opportunity. Now, my background actually is in education. I'm trained as an English and Spanish teacher. So that's the piece I bring to Guiding Right. And I've worked with this population, with youth, well, for almost 20 years now, for about 18 years. And so that's what we really head up here. Sorry. That's what we hit up here at the Tulsa office. And we do a lot of other things too. But education is the piece that I focus on because my kids are important to me. And I know that I'm not the only one out there that really wants those kids to know the truth so they can take care of themselves for the future.
That's right.
Outreach, we are a traditional outreach facility. So that means we're out there in the community, out in wherever we're needed. You'd be surprised some of the places I have been. And I'm just like Maya, I'm always carrying a bunch of stuff with me everywhere I go because it's just what happens. You'll either have
you never know. You never know.
Or your car trunk is loaded with stuff, and at any given point, you might need those things. So we're always ready to go. So.
Always prepared, ever ready, huh?
Always.
Always prepared. I'm gonna tell you, today's focus has been on Medicaid, of course, and trying to convince, and that's I don't use that term loosely or lightly. Encourage, cajole, coerce, whatever is required, as many people as possible to renew their SoonerCare benefits. But if parents are watching and they have young children, kids for a long time were eligible and parents were not. Now in Oklahoma, parents are also eligible. And so this is a really good opportunity for everybody to focus on not just their health, but the health and well-being of their family members. So Emma, come on in here and join us for a second. Emma, you guys, I don't know if you guys had an opportunity to meet Emma. She is our just smartest brainiac person on healthcare in Oklahoma. Emma, I don't know if when we expanded Medicaid, we got a big expansion on kids or not, but did we get, when we expanded Medicaid a few years ago, did the number of kids go up too?
Yeah, I think it's been difficult to kind of parse out the data on that because we've had this continuous pandemic coverage for about the same time that we've had Medicaid, or actually longer than we've had Medicaid expansion. So we've had a lot of kids maintaining their coverage or gaining coverage. What we do know from other states that expanded Medicaid in like more normal times is that when parents become newly eligible for Medicaid and they enroll in that coverage, it's much more likely that they realize their children are now eligible or have been eligible and they get them enrolled as well. I think particularly relevant to this conversation though is Medicaid expansion is really important for like the older teenager just moving out of their house, that kind of age range. Maybe going into college, maybe going into career tech or the workforce, because a lot of folks, who might have SoonerCare when they're 17, 18, before Medicaid expansion would have lost it when they turned 19. However, Medicaid expansion increased the income eligibility level so that more people that age can keep their Medicaid. So I think that's been really impactful for a lot of people in that really important transitional time.
And that's key before we let Maya and Michael go, the two M's, because of what you do, who you serve. A lot of people think AIDS, HIV is just something that impacts gay white men. But you said it, Maya, the largest single growing population is among Black female. And then, Michael mentioned this critical age group of young people who sometimes think they're invincible anyway. So Medicaid really provides an opportunity for that 18, 19, 20, 21, 22-year-old who doesn't think about their own health care to really, even if they don't think about it when they need it, it's there for them, which is significant. So Michael and Maya, I just want to say thank you for what you do. Thank you so very much for providing a critical service to everybody who needs this service, and then being a resource for all the other kinds of things that you don't do to help people get to those services. Thank you both very much.
You're welcome. Thank you for this opportunity. We appreciate your time.
Thank you, guys. See you soon. I'll see you in Tulsa.
Have a great day. Thank you.
You guys have. It's just so much going on in the world. Sometimes it feels like the weight of the world is upon our shoulders, right? And, it's been a long time since I've thought about STDs. I wonder why. This is not a kid's show, so forgive me. I couldn't resist a little laughter. It's always important, guys. But it really is significant. I don't know about you, Emma, but I have looked at numbers and the increase in the rates of infection in Oklahoma. And, we don't do well. Our numbers are really critical. And when you think about all the kinds of things that exposure to an untreated STD can lead to health wise, it means coverage and access to care becomes even more critical. So,
Right. Yeah. And I think one of the things I was thinking about while y'all were having that conversation is coverage is important, but also healthcare and access to healthcare goes so much broader than having access to coverage. That's kind of the baseline, right? Everybody needs to have access to some form of insurance. But then we also have to think about making sure that we have an adequate provider network that accepts all the different types of insurance, that folks in rural areas can access care without having to take off work and drive all day. That people leaving prison can, immediately access the care and the prescriptions that they need. So I just think, particularly relevant to that conversation, it's really important to think really broadly about healthcare and what access could look like, what it should look like.
That's right. Thank you for saying that, Emma. That's so important. We're getting ready to transition to a panel discussion, a pre-tape panel discussion. But before we do that, there are some magical folk helping us behind the scenes. I don't know if it's time or not to give a gift card. What we promised to our viewing audience is to have a bit of fun and a whole lot of information to be imparted to you that could really change one's life. But sometimes $25 or $50 can really change a person's life because it'll buy that tank of gas or take kids to McDonald's or whatever is necessary. So if those magical folk who work behind the scenes can let me know if there's a name. We do have a name. We do have a winner who can claim their prize. Yay! Let me open up another magical box on my computer. T. Brown from Oklahoma City. Your name has been selected. And since you're our first winner, T, we're going to give you a $50 Visa gift card to do whatever the hell you want to with it. But we need to know how to reach you. So we need you to email us at info, I-N-F-O, at okpolicy, that's okpolicy.org, info at okpolicy.org to claim your prize. So if you are listening and watching, send that information. If you didn't get info at okpolicy.org, just go to our webpage, okpolicy.org. And there'll be some information there about how to reach us so we can make sure we reach you. T. Brown, and congratulations to you. Thank you, Emma. A few weeks ago, we had a conversation. You mentioned providers, you mentioned other folk, but we had a conversation with a group of women who are in the trenches, who understand why this work of renewing one's eligibility becomes critical, and for a whole lot of people, life-saving, literally life-saving coverage and access to care. So what we'd like to do now, to those of you who are watching, is just to switch on over to this tape. I just want to say thank you before we start this pre-tape discussion. I want to say thank you to the panelists that you'll be hearing from, and they will introduce themselves again very briefly. But I want to say thank you to Isabella Lawson. Isabella is the CEO at Community Health Centers Incorporated, Oklahoma Community Health Centers, Community Health Centers of Oklahoma Incorporated. A lot of people know them as Mary Mahoney or the Perry Clausen Center. They're just clinics that they operate among about 6 or 7 clinics. And I have to announce too, they will be operating the newest Oklahoma City Wellness Center located at 36 in Lincoln. So I'm excited about that because it's down by my house. Another panelist is Janine Yanis Jones. She is the CEO of the Health Alliance for the Uninsured. It's an organization comprised of clinics across the state who provide services to people without insurance. Also, thank you to Yvonne Myers, who is the tribal healthcare specialist. She's a consultant, but she does tribal healthcare with the Potawatomi tribal tribe, along with several other, I think, Indian nations. And then finally, but not least, of course, Miss Grace Burke, who works with the Morton Comprehensive Health Service in Tulsa. So thank you to the four of you for taking the time with us to share your thoughts about Medicaid renewal and the importance of coverage here in Oklahoma. So, Annie, I'll let them take it away. Well, good afternoon, everyone. Thank you again for being with us this afternoon. Our next 30 minutes we'll spend with four individuals who have a lot of experience in providing healthcare services, but particularly to people who would not otherwise have access to care. So I'm very pleased to bring on with me this afternoon for a little discussion about what they do and the importance of their work. First is Isabella Lawson. Isabella is the CEO at Community Health Centers, Inc. of Oklahoma. It's a federally qualified health center. We also have with us today Yvonne Myers. Yvonne works with Potawatomi Tribal Health Services. I may not have gotten that right, Yvonne, so you'll have to correct it. But she also has 40 years plus of public health service with the Oklahoma State Department of Health and knows all things good about healthcare access, particularly in tribal world. I'm pleased to also welcome Grace Burke. Grace is with the Morton Community Health Center in Tulsa, Oklahoma. It also is a federally qualified health center. And finally, but extraordinarily important to many individuals across the state of Oklahoma, is Janine Yanish Jones. Janine is the executive director, CEO, lead person, hardest working person I know at the Health Alliance for the Uninsured. And the Health Alliance represents a group of clinics that provide services to people without health insurance. So these are all my dear friends. I've known many of them for decades. I just want to welcome you all with us today. Thank you for being with us.
Thank you.
So to start our conversation, I'm just going to ask each of you in round robin fashion our first question. So I think our listening audience, our viewing audience wants to know a little more about who you are, your organizations, what you do, who it is that you serve. So Isabella, since you're right next to me, okay, I'm going to call on you first.
Okay. Thank you, Angela. Isabella Lawson. I am the CEO of Community Health Centers Incorporated, also known as Community Health Centers of Oklahoma. We are a nonprofit organization, a federally qualified health center, and we've been around for over 50 years providing services to health services to the public. Currently, we have 7 clinics in Lincoln, Logan, Potawatomi, and Oklahoma counties, all in central Oklahoma, of course. We provide medical, dental, behavioral health services. We also have pharmacy and case management services. Currently, we serve Medicare patients, Medicaid patients, uninsured and private insured patients, with the highest of those being Medicaid. 60% of our patients are Medicaid patients. We are, of course, we've been in an urban area, Oklahoma City, for years, but we're also, the key is reaching those rural areas for those that are needing services that we go into. Of the patients we also serve of Medicare we only have 5%, uninsured 14%, and private insured patients is 20%. Now, before Medicaid expansion, we had over almost 60% of uninsured patients, which is how really the groundstone that FQHCs was founded on was serving uninsured patients, but it has flipped since Medicaid expansion. I've also been in Community Health Center of Oklahoma for over 15 years.
Great. Thank you, Isabella. I'd like to say I got my start in healthcare policy back in 1981 at it was Mary Mahoney Community Health Center. It was one site only. So glad to have you with us. You mentioned the uninsured. Janine, I'm going to have you introduce yourself now because Isabella talked about the numbers at 60% and then post Medicaid expansion, how the numbers reduced, but clearly the uninsured is still with us. Tell us more about the Health Alliance and the organizations you work with.
Sure. Thank you, Angela, and thank you for the opportunity to serve on this panel today. And I love seeing our community partners here too, and you guys are all doing amazing work. I get to work especially close with Isabella because sometimes when she has uninsured patients that need additional services, those are available through our office. And we're at Health Alliance for the Uninsured, and we work with 92 free and charitable clinics in the state. And then we also provide some additional services to the federally qualified health centers that are serving uninsured patients as well. About 1 in 4 people in Oklahoma are not insured, which is really a crisis. We have one of the highest uninsured rates in the nation. And so providing access to healthcare for those who would be otherwise unable to obtain it, that's our mission. And it's a very big mission. And I know everybody here, we all lock arms and work together to try to provide access to healthcare. And Angela, you've been a forerunner in this for many years, and you've done such great work and kind of paved the way for some of us too to continue to find these connections and access for people who are really struggling with even just their day-to-day survival needs. And then to add the fear and insecurity that you have by not being insured in case a medical emergency happens, and then maybe you have a medical crisis, then you add another layer of behavioral health concerns in addition to the physical health needs too that are happening. So our organization, we have 5 main programs. We provide specialty care referral, medication assistance. We help people navigate a very complicated healthcare system to find access to healthcare, whether they are Medicaid eligible or can go on an employer plan, marketplace plan, going to the federally qualified health centers, or if that none of those are an option, and trying to get them into a free clinic is how we kind of work that funnel approach with our partners. And then we have special projects. Our big project we're working on right now is an uninsured diabetic program that we're doing in conjunction with United Health Group. And fifthly, we are just an overall resource when doing, we do an annual conference, we do trainings. If we have excess of some type of supply that's been donated to us, we make that available to the free clinics. Examples are if a doctor's office goes out of business and they want to donate exam tables or something like that. Or during the pandemic, we were helping to facilitate distribution of masks and hand sanitizer and gloves, all the things that we were needing to keep our patients and providers safe. And we got to work real closely with Isabella even during that time. Well, we talked about vaccines, and now even, it's flu season, so we're working hard to provide flu vaccines to some of our most vulnerable individuals in the state.
Great. Thank you. That's a big task that you have, and couldn't do it by yourself. So I just want to take my hat off to you and all the partners you work with. Yvonne is with us. Her work is a bit different. So Yvonne, tell us about your work, not maybe just with the Potawatomi tribe, but maybe there's work that you do, and maybe even a little more about tribal services. There probably are many misperceptions out there about what happens if you're a tribal member and your ability to access care. So enlighten us a bit about what you do, the organizations and the tribes that you work with.
Thank you, Angela, for inviting me, and it's an honor to be here on this distinguished panel because I know we are great advocates for healthcare. So yes, I'm a consultant for the Citizen Potawatomi Nation Health Services, and we are headquartered in Shawnee. We have 2 clinics, one in Shawnee on South Gordon Cooper and the other one out on Highway 40 by the Grand Casino. We also have a specialty imaging clinic. We have services that include primary health care, imaging. We have a chiropractic, we have dental, we have vision, we have physical therapy. And so that's pretty much what makes, and we have pharmacies located both at our East and West clinics. We do a full range of services. We do not have a hospital, but we also have urgent care. So again, a lot of good services that tribal members can access. Basically, we serve members of federally recognized tribes. Okay. And then for Citizen Potawatomi, we also serve our employees that are employed by the CPN Nation. And CPN is the largest employer in Potawatomi County, as it turns out. So that's a little bit about what we do. tribes, Oklahoma has the largest number of federally recognized tribes of any state in the nation. And we have a network of clinics that are either IHS, tribal, or urban Indian clinics. So within each of our clinics, we have patient benefit specialists that their goal is to be able to assist in people with getting their Medicaid eligibility. We assist with educating and enrolling or assisting our elder members with Medicare. When people are needing to sign up for Social Security or disability, we help link them together. We have just a host of services that are available. But again, it's not everything. And one of the things that was extremely beneficial for tribes and for Oklahomans as a whole was Medicaid expansion. And just as was mentioned earlier, with expansion of Medicaid in July of 2021, a large number of our population was able to get onto and have services through Medicaid covered. Because one of the things I mentioned, we have a lot of services, but we don't do everything. And so that brought additional services to our membership and to our employees that we might not have otherwise had. There's so much we can say, but I think one of the big things that you'll hear some of us talk about is assisting with eligibility. We want everyone that is eligible for Medicaid or Medicare to be able to access those services. We have patient benefits specialists. Oklahoma has an excellent eligibility system where we can get real-time eligibility, and we're always willing to help and assist in any way.
Great. Thanks, Siobhan. I appreciate that. We have also with us Grace Burke from Morton. Grace, come on here with me, and I want you to tell us a little more about the FQHC, the Federally Qualified Health Center that's based out of Tulsa. And I don't know which came first, if Mayor Mahoney or Morton was first. You can enlighten us too about that. Tell us more about Morton. And when you finish telling us about your organization, who you serve, what you do, I want you to stay with me because you're the one who raised the point about Medicaid eligibility. We had the expansion, then COVID and the public health emergency, and people were able to keep coverage, and now things are changing. So just park that for a moment, but that's going to be the next question, and I'm going to start that conversation with you too, Grace. So tell us about Morton.
Hi, everyone. I'm Grace Burke from Morton Comprehensive Health Services. I've been at Morton for about 10 years, but have been in the healthcare arena for more than 40. So now you know how old I am. And it's changed so much in just the last 10 years. How about it's changed in 3 years? So Morton, Morton has been around for a really long time. It has its foundations in the Tulsa Race Massacre, where we're located. Our main location is in North Tulsa, where the race massacre occurred, and there were no hospital facilities up in North Tulsa at that time. And so the Red Cross came in and built a temporary hospital, and things moved on over years and years, and the hospital grew, and it grew into Morris Willows and then Moton Hospital, which was around in the 50s and 60s and 70s. We have a lot of folks who still come to Morton who were born at Moton Hospital. We've recently, or since then, in 2006, had a very beautiful main location built down the street from the original Moton. And the name was changed to Morton Comprehensive Health Services. We are an FQHC, Federally Qualified Health Center, like Isabel's Health Center as well. And so we have all the range of services that everyone has been talking about. We have primary care, of course. We have a pharmacy, optometry, dental. We have the full range of services right in our main location, and we have 5 other locations. 3 of them are embedded in other places. For instance, we have a Healthcare for the Homeless clinic, and it's located in the Salvation Army Center for Hope in Tulsa. And we serve the homeless community. We have been for more than 35 years as a Healthcare for the Homeless funded clinic through the federal government. We also have a health center embedded in a housing complex in West Tulsa. and one embedded in Family and Children's Services in Tulsa. So you see that we like to partner with other folks to give people a more well-rounded experience in other places to access healthcare services. And of course, all of the folks accessing those other locations, including Nowata, can come to us at our main location where we have every service under the sun: lab, x-ray, WIC, behavioral health, if I didn't mention that. The whole idea with an FQHC, a federally qualified health center, you might have heard it called a community health center, is that we serve everyone. No one gets turned away. No one gets turned away for failure to pay or no insurance. We serve folks who do not have documentation to be legal in the United States. We ask no citizen questions. Folks need health care. They need to be able to take care of things, have a provider that they can trust, a way to manage their health and wellness, and to manage your chronic conditions. And that's what we're here for. We're here for everyone, because not just people with insurance need health care. Everyone does need to stay healthy. And what happens when they don't is that they don't seek care when they are in the early stages of some kind of problem. And then it gets to the point where they need to seek emergency care. And that overloads the hospitals, and it puts a lot of cost on the healthcare system. And so having somebody get routine care and take care of issues within a primary care setting obviously is much more affordable for them and is better for everyone to maintain the quality of life and their health care. We do have enrollment services at Morton, as well as the other ladies have talked about, where we help people enroll in Medicaid and Medicare and also in Marketplace. We try to make sure that we guide people to whatever is best for them within their healthcare needs and also their ability to pay for something.
Sure.
We generally see folks who are lower income, but I go to Morton. My mom goes to Morton. She's 94. We serve everyone with insurance, without insurance, no matter who they are. That's what we're there for.
Well, great. Thanks. I'm going to ask you this question, Grace, to start the next part of the conversation. And each of you, I may ask the same question, just a little differently, though. But, we know that, again, Medicaid was expanded here in Oklahoma a few years ago. Yvonne alluded to that. And I think everybody on this call is engaged in making sure that state question hit the ballot and passed. So we saw this great influx of people into coverage, some of whom, a couple of friends of mine who had not had health insurance for more than 25 years. Yeah. So we know how important it was. Then, of course, the pandemic, people stayed in the program. But right now, across the country, people are being disenrolled. So, Grace, talk to us just a little bit from where you sit about this whole scenario, this whole event of disenrolling people from Medicaid and what people can do to make sure they keep that coverage, because Medicaid is important. You know that. And if you want to talk a little about why that's important, we'd be happy to hear those thoughts. So just for a couple of minutes, let's talk about this disenrollment and the need for people who are covered through SoonerCare Medicaid to do something and what they need to do. Come on with me, Grace.
Okay. So first of all, if you have SoonerCare, everyone in the entire state on SoonerCare has to re-enroll. Redetermine their eligibility. So even if you are still qualified for SoonerCare, you have to go into your application online or have somebody come help you. And we're happy to help in the Tulsa area. There are people on the phone that can help, but check your status, update your status, make sure your address and all your information is correct. Make sure that your income is correct. And if you come to get assistance, make sure you bring paychecks or whatever, because they often want uploads for proof of income. But don't delay. We've got a lot of folks who wait till the very last minute to come in and see, and they don't have the right documentation to get them renewed. And, there are a lot of people falling off anyway. and I say this every day to folks, okay, so you had insurance for 3 years and nobody got kicked off, and now you're over income, and you have been for a while. So you're going to lose your SoonerCare, but there are more options out there for you. And Marketplace is the other option. So most of the federally qualified health centers, Yvonne's people, there are a lot of people out there helping people enroll in Marketplace, and you can do it yourself online as well, but it's kind of complicated. And so there are a lot of folks out there to help you. But this unwinding, and you're going to hear it called the Medicaid unwinding. Remember, SoonerCare in our state is Medicaid. The Medicaid unwinding has become very confusing for people. And it's a surprise because people don't remember having to renew every year. Well, because during the pandemic, you didn't have to. Nobody could come. So I encourage everyone to check their accounts, make sure you still qualify, update everything, get renewed for another year, because we've got some other things starting to happen. And let's not talk about that, because we could talk about that for a couple of hours. The Medicaid mandatory part of SoonerCare is coming soon. But let's just get everybody through the end of the year with renewing their accounts, and then choosing some other options if SoonerCare is not going to be the insurance that you're going to be able to be eligible for.
That's right. Thank you, Grace. Isabella, I know that a big chunk of your population are folks with Medicaid, Medicare. So I want you to speak to a little bit about why it is important, you think, and at your clinic, for those individuals to keep that coverage. But for those individuals that Grace described who been floating along for 3 years, got another job, got a better paying job, no longer eligible for SoonerCare in the state of Oklahoma, there are other options available for them, particularly, I still call it Healthcare.gov. It's the marketplace, but if you go to Healthcare.gov, you can find out about it. Anything you might want to share, too, about the importance and value of that program, please weigh in. So, Isabella.
Yes, ma'am. Just to piggyback on what Grace said on how important it is to renew, not get frustrated, although it is frustrating. A lot of our persons that were new to Medicaid, we had to do a lot of health literacy, a lot of health education, because they had no idea. They never had insurance before. So you really mean I can come to the doctor and get these services? So, but now here we are, you're getting a green letter, a purple letter, whatever it was they were getting mailed, and it was just causing confusion. But they need to know that we are here to help. And what we've done even more is every outreach event we have, we take case managers with us to help enroll, to help people verify they're still enrolled, to make appointments for them to come into office to get re-enrolled, whatever we can do to help you. But continue utilizing those services. Medical, and we keep saying medical, but dental. Dental has been huge for our patient population, being able to get dentures and actually get their teeth cleaned on a routine basis. But yes, that is one of the things. And it is sometimes frustrating because it is quick sometimes as far as real time, but there's other times when they come into the office and get case management help, it takes too long. Sometimes we get those extra waiting periods, and a lot of people have to go back to work, etc. But once again, it is important that you continue to strive for health insurance and to stay enrolled in SoonerCare Medicaid options. Thank you. And I guess at Morton, there at your facility, if a person is not eligible for Medicaid, there's somebody that'll help them figure out Marketplace, or if they're old like me, Medicare, or other options, correct? That is correct.
Okay, good. And for those who are watching now, don't worry, we're going to make sure you know how to reach all of these organizations, plus other resources that exist throughout the state. Now, Janine, we've talked a lot about Medicaid and the fact that there are people going to lose their coverage. That's a fact. They may, though, have employer-based coverage that can replace it. But, still, like the poor will always be with us. Clearly in Oklahoma, no matter how hard we fight and what we do, there are going to be people who have no health insurance. So you do a lot of work with those individuals and the people that serve them. If you don't mind just speaking a bit about some of the barriers that people face accessing care, accessing coverage, and what the implications look like for people who have no health insurance. And so just a little bit, because that's an audience or a group of individuals that now that we've expanded Medicaid, some people think have gone away, but not so.
Yeah. That's right. Yeah, because not everybody was eligible for Medicaid expansion, which it did help about 300,000 people. So we're super excited about that. 0 to 138% of federal poverty level with the income requirement. And our free clinics helped to be on the front line of that, because most of the people that they were seeing that had become eligible didn't realize they were eligible. So the free clinics were helping them get enrolled and figure out which healthcare provider to transfer to get coverage. Of course, now, the public health emergency is expiring, and we've been talking about that. And I think that estimated another 300,000 will be going off of our SoonerCare Medicaid program. One of the scary statistics that we've talked about before with that is, what the Kaiser Family Foundation shares is that when people lose their Medicaid coverage, it's 9 to 12 months before they get reconnected to healthcare. And sometimes it's not even because it's not affordable. It's just they don't know what to do. They don't take the action. That's what's so beautiful about the groups here that are saying, someone comes in, they're helping them figure out, well, do you need to just upload some paperwork, or can you get on a marketplace plan? Like Isabel said, that we want everyone to strive to be insured and have coverage, because that gives peace of mind. Statistically, evidence-based, people are more secure, less mental health issues when they know that if something catastrophic happens, they have health insurance. But then also, some of the individuals we serve, the most vulnerable, are also the most at risk, and also inadvertently have much higher health concerns than people that are managing their health care routinely and preventatively. So we end up getting a lot of people that are already in health crisis when they come to us, or the emergency departments, because maybe they have diabetes and haven't been managing their diabetes. So they're in a really serious condition. So it's really important that we're able to work within our network to help every person have access to healthcare, so that they can be able to manage their health condition, be able to have affordable, whatever that might be. Each person's different. Sometimes affordable medication for the free clinics that are free medications, but sometimes it's a Walmart generic brand or whatever. But and then also dealing with the co-occurring concerns of poverty. It's really hard to prioritize food, shelter, and then medicine, right? Yeah. So trying to be able to be a partner in that solution, so that we can have a healthier state.
And I'm glad you mentioned the fact that people who don't have health coverage don't necessarily have that sense of security. And I always thought that, too many folk believe, oh, I'm not covered because I don't want to be, that there were individuals who just refused to be covered because they just didn't want to be, or they thought they didn't need it, or they'd rather spend their money for something else. But that's a myth. That's false. In reality, people want to be covered. They want that insurance, and it does help us with our mental health, our emotional health, just that whole ability to be stable and live a functioning life. Janine, let me ask you this before I move to our closing conversation with Yvonne. How many clinics are there out there serving individuals with no health insurance?
Statewide, we have 92 free and charitable clinics, all different sizes. 90% are run by volunteers, a very highly credentialed volunteer group, but a lot of really wonderful people that want to give back, maybe after hours or in their retirement, to help people be healthy, because we all know that there's a huge need, and everybody's just trying to make a difference to that one, like the analogy, that one starfish, like I helped that one.
That one starfish. I like that story. We'll save that for another time. Yeah. And Yvonne, you've been, I've known you from your days at State Health Department, and I work with you now in any number of capacities, and you're an individual that's kind of knows a whole lot about a whole lot of things. So if you just kind of maybe sum up for us a little information again about the importance of Medicaid and re-upping and filling out the forms, but also just generally talk about the importance of health and wellness and well-being, and why it is important for people to get connected with coverage, or if they don't have coverage, to really try to seek out the care. And your thoughts generally about the state of the healthcare system here in Oklahoma.
Thank you, Angela. It's a big task. I think what right now the pressing thing before us is the public health emergency unwinding that Grace spoke to. And we don't want individuals to become discouraged. A lot of them didn't receive the mail telling them that they were losing coverage. They're not understanding. They haven't ever had to do a redetermination. And so I think the message from each one of us is to everyone listening, you may still be eligible. Please, if you need assistance, reach out to one of us. County health departments are another good source. A lot of those county health departments have staff that could help you with eligibility. Your IHS, tribal, and urban Indian clinics are there. The community health centers. So please reach out. We all want you to have access to care. And then also the Affordable Health Care Act, the marketplace that we've talked about, are other options. So I think it is so important for quality of life. You heard Grace mention that, and I think each one of us has touched on that. And sometimes the way we accomplish quality of life, many times, is by getting those services, health services we need, whether it be behavioral health or medical, to give us that full quality of life that everyone deserves. So, I just encourage everyone. I chair the the National Tribal Public Health Emergency Unwinding Work Group for CMS. And I have never seen a time in all my years working in health, I've seen the administration want so badly for everyone to stay enrolled and have that coverage. And so you've got the backing from top down and bottom up. We want you to have that coverage. Reach out. Don't give up. You've got people here that will do what they can to help you if at all possible.
Thank you all so very much. I don't think we have to convince people out there listening and watching that healthcare is important. I hope we don't have to. But what we have to do is educate and teach individuals that there are resources, there are organizations, there are places that they can go to access the care that they need or access that coverage that they need. So again, thank you all so very much for your expertise, for your time, for your sharing. But from my heart to yours, thank you for caring for Oklahoma's people. Thank you for caring for those who are most vulnerable, Janine, those who would not know where to go. Same for all of you, the rest of you who are providing coverage to people who may have care to people who may have coverage. Sometimes that coverage doesn't pay very much. So I know you don't get all that you're worth at those federally qualified health centers, and the tribal reimbursement sometimes from the feds, I know it's just not enough. So thank you for your commitment and for being good partners with other organizations that stand just like you across the state. So thank you. We'll make sure that those viewing have information about how to reach out to you and other organizations across Oklahoma. You guys have a good day.
Thank you.
Bye. Thank you.
Bye.
Bye.
All right. Thanks so very much. That was a great panel. Those are all my friends. I get to see them and work with them on a regular basis, but just to hear them talk again just says there's hope. There are a whole lot of people in the world doing great things for a whole lot of people who are in need of help. I did promise that we would provide information about how you reach the federally qualified health centers. Variety Care is another one of those FQHCs with locations across the state. So if we're not able to give you their phone numbers and addresses and contact information, the Health Alliance for the Uninsured, Janine says, operates 92 free clinics across the state. Please go to togetheroklahoma.org, togetheroklahoma.org. Give us a little bit, but we'll definitely post contact information there so you can find those clinics, those locations that provide, I think, some of the best, highest quality of care that one can receive in Oklahoma. Those are your friends too, Emma, right? You work with them on a regular basis. They're pretty smart folk, right?
Yes, they truly are. And they are doing great work every single day to get people enrolled. I have worked a lot with Yvonne and Grace in particular as we rolled out Medicaid expansion and as we're moving through the unwinding. And the insight that they have as people who help folks enroll every day is always really helpful in figuring out, what what needs to be better to make it easier to enroll. So I really appreciate all the work that they do.
And for those who just don't know, I'll give them another kudo. They also meet on a regular basis along with a few other folk to talk about some of the problems and issues. Because they are doing this work on a regular basis, they're able to firsthand identify problems, gaps, little quirky kinds of things that are occurring in the system, and have developed a great relationship with the Oklahoma Healthcare Authority and great inroads, even with CMS. That's the Centers for Medicaid, Medicare Services, the federal entity that oversees and operates Medicaid. So we have some really important folk with us today. I want to announce another winner. We have more winners. Of course, we have winners for gift cards, and we're going to do a couple of others. And, you know, it seems unfair to give the first one $50 and then reduce the value of the other. So for our next $50 gift card goes to Kenzie Parton, Parton. Kenzie from Shawnee, wherever you are, Kenzie, great picture. Make sure you go to our info at okpolicy.org, info at okpolicy.org, and give us your contact information so we can get that $50 gift card to you. We've got a couple more winners we're going to announce here, so just hang tight. So because our four panelists earlier talked about the importance of renewing, signing up, reestablishing eligibility, redetermining your eligibility for Medicaid, we have a really, really corny, brief video. It's not what we really wanted to do, but it's the best that we could do. So those of you who are watching, we love you dearly. We know you love us, so forgive us, but it'll at least give you a little example of how easy this process of redetermination or renewal is. It's very simple. You can make a phone call. Sometimes you're on hold just a bit, or you can go online and sign into your account. And it takes all of just a matter of minutes to reestablish your eligibility for Medicaid. So we're going to take a few minutes. Forgive the narrator. That would be moi. But it'll give you an opportunity to get an idea of what you're going to see when you go online to renew your eligibility. All right, Annie, we're ready. All right, hello, everybody. Just a quick review of the steps that you can take to make sure that you don't lose your Medicaid coverage. And we're going to encourage you to do the same for anybody that you know, friends, family members. So once you get to your web browser, we're going to simply enter something pretty simple in here. I'm just going to type it in so you can see it. I'm not the world's greatest typer, but I'm going to get rid of a bunch of this stuff. Oklahoma.gov / Oklahoma Healthcare Authority, OHCA / renewals. Technically, that's all you need to enter. And then, of course, it would bring you to this page where we are already there. SoonerCare renewals are coming back, and that's what today is all about, making sure you don't miss your opportunity to renew your coverage. And it reminds you that you could be at risk of losing that coverage if you don't update your information. So this process is very, very simple to ensure that you're updating your information. So we're going to click here to update the information, and then you'll have the screen that has you to enter your user ID or your password. Now, like many of us, you may have forgotten your user ID, your password, or both. And if that be the case, simply click the appropriate link here, and it will prompt you with maybe some security questions that you saved or some additional information that you utilize to set up either your ID, user ID, and your password. But once you enter the correct ID or email address in your password, simply click log on. And it will take you to your page, the My Benefits page, a page that every single person who's enrolled in Medicaid has. And if you're a family, everybody in your family will be listed under one person's name. So the information that you enter, for the most part, for that one person will also apply to individuals. Now, this example that we're using, this individual has already been approved because, like everybody I know, I've encouraged them to go through the renewal process. So you notice there is a status approved here. If you had not updated your information, it may still say approved, but what you want to pay close attention to is your end date, because it could very easily say October 31, 2023. And if that be the case, you only have a few days to go in and update your information. The good thing about the Oklahoma Healthcare Authority system, though, is once you update the information and are deemed eligible, the approval is effective immediately. So if you were to get out of the system, back in, and you had updated it correctly and you were still eligible, your status would have immediately changed to approved. So again, your status and your end date are key. Now, once you've identified that you need to do something, it'll tell you here, it'll just simply have you click. There'll be a link right below your program that you click, and it'll take you to a sequence of questions. And for the most part, those questions will just simply ask you, is this information still correct or not? And if it is correct, you just simply mark the appropriate box. If it needs to be updated, do that as well. The whole process only takes about 5 minutes, maybe 7, depending on how many people are in your household. It's a very user-friendly process, and I don't think any of you will have any problem doing this. And if you do, simply reach out to us. There also may be a need to upload information if they ask you for current, if your income has changed or you have a new job, or your old job is not paying you as much, or anything like that has happened and you need to provide documentation, simply use the link on this side to upload the information. So I'm going to stop there, and again, encourage you, if you have questions, just reach out to one of our partners that have been on the call with us today, or give us a shout and we'll provide that information at the end of today's program. Thank you again. Thank you, Annie. Annie is the magic person behind the screens doing all this magical work. That was pretty doggone corny, but it is a simple process, right, Emma?
Yeah, I think it generally is. There are, of course, always some cases where people might need a little extra assistance, and in that case, you can always call the healthcare navigators. You can find all their information at myokplan.org, or you can call the SoonerCare helpline. I don't know the number right off the top of my head, but you can find that number at mysoonercare.org. Oh, so there it goes.
We don't know all these numbers. Annie knows these numbers. I told you she's magic. I have a friend who took advantage of the expansion, an adult friend. So she was one of the Healthy Adult Program participants. Easy, smooth process to get her eligible. But during the course of the last 3 years, she became eligible for Social Security supplemental income, which did complicate her renewal process to some extent, because there are some individuals, and we'll talk more about this here in just a little bit, whose renewal process begins with the Department of Human Services. I don't know a lot about that, but I know there are some glitches in that process. So we'll talk more about that later. I just don't want people to be discouraged. I want people to know that if you just take this step, and maybe necessary to take an extra step or two, you will be successful and your health coverage will continue. We have one more live spot. We have another partner. This is a great partner right here in Oklahoma City. They've been with us too since July of 2020 when Medicaid was expanded here in Oklahoma. The OIC, I know them too as Opportunities Industrialization Center, but no one calls them that anymore. They're all known as OIC, and Glenda Parrish has been one of our really critical partners, and Alicia's there with her. These are folk right here in Oklahoma City. They were our trainers. You know, when we expanded Medicaid, there were a whole lot of people, 300,000 plus of them who came and enrolled in Medicaid. It was a lot. So we at OK Policy partnered with the organizations across the state to help us do that. And we trained individuals how to do that. Although Medicaid enrollment in Oklahoma is a fairly simple process, nationally recognized, we still knew that there were individuals who couldn't sit in front of a computer or on their phone to do it by themselves. So OIC, thank you, ladies, was one of those organizations that learned not only how to help enroll people in Medicaid, but became navigators to help people enroll in Medicare or Healthcare.gov. We'll talk about that more later. And then trained other individuals. So Glenda, thank you very much. Tell us a little more about OIC, what it is that you do, Glenda. And then we're going to talk about what's important for you, not what you, but what OIC does. You can even promo this big event you guys have coming up this weekend.
Well, I'll leave that up to Alicia. But what I do at OIC is I am an intake advisor and a student advocate, which really, I mean, it's a case manager, but we like to call it student advocate because we're advocating for the students. So I'm all over the building. I am assisting everywhere, as is Alicia. We never get a chance to sit down. We just try to make it happen, you know, seeing that the students have success in getting their GED. And then, you know, also the Medicaid SoonerCare piece comes in as well, because now that we are doing a pre-game huddle, which, you know, transitions into an orientation, that I still do mention, you know, SoonerCare and ask them if they're enrolled, if they know anybody or anything like that. So we probably won't stop mentioning it because it is still handy, and not a lot of people know that they still may be able to qualify.
Mm-hmm. That's correct. So you're on the grassroots. I consider you a grassroots provider. You see regular people every day. Mm-hmm. So it is important for you to continue to mention this, the importance of Medicaid and SoonerCare. The students that you talk to us about, the students that take advantage of your programs. And I don't know if this is a question for Alicia or whomever, but the students that come to OIC, what do they study? Just tell us more about that organization, because there may be viewers out here who've never heard of OIC at all.
Okay, well, OIC of Oklahoma County is an adult learning center, but I like to think of it as a lot more than that. It's a one-stop level up shop. We help people to get their high school equivalency diploma. Excuse me, we have computer classes, help people learn to speak English. We also have a re-entry program for 18 to 24-year-olds that are just as involved. We have the OIC Business Academy. So, you know, if there's something that you're needing to do to level up, OIC has a spot for you. One of the main things that we do here is we build the whole person, not just their academics, not just the skills that they're needing, but just like having, you know, the Medicaid enrollment here. You know, we also partner with other organizations, you know, to help people that need something. If our students are, you know, getting ready to be evicted from their apartment or their lights are getting ready to cut off, we partner with other organizations that can help them with that, because we know that you can't focus on your studies when you're getting ready to be evicted, or you have transportation issues or childcare issues, or maybe your child is sick and you don't know how to get that taken care of, but then they talk to a student advocate and then they find out about SoonerCare if they don't already know. That's right. And, you know, we've been serving Oklahoma County for 57 years, and we're celebrating that this Friday night at the OIC Black and White Ball. So there's still time to get tickets and sponsor a table if that's what you'd like to do. You know, because it's for a worthy cause. I was talking to our executive director, Ms. DeJohn Jones, and you know, we talked to her about the different statistics and different things like that. And, you know, 1 in 5 adults in Oklahoma read below a 5th grade level. You know, in Oklahoma County alone, there's approximately 75,000 individuals over the age of 18 without a high school diploma. And that's scary. You know what I mean? And so, I mean, there are a lot of adult learning centers in Oklahoma City, but I would like to think, you know, maybe I'm biased, but I would like to think OIC is the best place to get your diploma.
I'm biased as well.
Wow. We had a question actually from a viewer that wanted to know if OIC is only in Oklahoma County. I know Dr. Reverend Leon Sullivan started it. It started nationally. Are there other, I don't know how to describe them. I know they're not chapters.
There are other affiliates. There are 32 affiliates in 29 states, but OIC of Oklahoma County is the only one in Oklahoma.
Okay.
But there are other OICs in other states.
Okay. All right. So the viewer, I think, was from Comanche County or maybe Carter County. I'm not sure, but the southern part of the state. That just simply says we need more OICs across Oklahoma. I don't know how we start one, but I'm sure because they're different from the tech centers. They're a lot different from the career tech centers, right? And so maybe describe some of the key differences, one or two, in terms of maybe the people you serve or how you access services at OIC, so people don't get confused and think it's maybe just as difficult to get to OIC as it is to get to a career tech facility.
Well, no, it's as easy as making a phone call or going on our website and filling out an inquiry form. You would call us at 405-235-2651 and schedule an appointment to come in. Well, first of all, they would ask you some questions over the phone to see what it is that you're needing, what you're interested in. And if it's something that, you know, we would be able to assist you with, then all you would do is schedule a time to come in and take your assessments and get enrolled. As far as like getting a diploma, there are 3 classes that are offered. There are daytime classes, evening classes, and online classes. As far as computers, all of that is done, you know, in-house. So if you're needing to, you know, brush up on skills, you know, to move up in a job, or if you're, you know, just wanting to come into the new millennium, you know, and you don't have any skills at all. I mean, our constituents go anywhere from 16 on up. So maybe the traditional school setting, it's not benefiting you, you know, it's not helping you grow. You know, maybe you have a different learning style. We take into account different learning styles, different abilities, you know, because maybe with your learning style, you don't have the ability to just sit and listen to somebody talk at you. You know, you might have, you know, some sort of diagnosis, ADHD or dyslexia or something like that. And your lesson plan is, I mean, it's I would say it's tailored to you, even though it's a group setting, but they still take into account your personality, and like I said, your abilities. And that's with the business academy, as well as, you know, getting your high school equivalency diploma. I mean, we just take all of those things into consideration, you know.
Because what
we're talking, go ahead, Glenda.
Next person.
Right. Everybody's not the same. Even though we try to make everything a blanket, it's just not going to work for everybody. I mean, it's just the same thing with a recipe. You can give 10 people the same recipe and it's probably going to taste different. You know,
that's absolutely right. The individualized educational plan that students at OIC can get. You know, you mentioned earlier about justice involved individuals who come to OIC, 18 to 24-year-olds. And we know that that's part of this age group that's always underinsured. And people leave prison not knowing, or prison or some other incarcerated unit, and don't have a clue of where to go. So my only guess is that a lot of those people are some of the folk that really need health coverage, and maybe even pin up needs, healthcare needs that weren't treated when they were incarcerated. So we really appreciate what you do. I want to give you a chance to give another shout out about that black and white ball that I won't be able to come to because I'll be out of state, but you know, have fun enough for me. But so if a person wants a ticket or if a person wants to attend, who should they contact?
They can either call here at the office, 405-235-2651, or they can go to our website, oicokc.org.
And that oicokc.org has been floating across the bottom of this screen since you've been on with us. I just want to personally say thanks to Glenda for her work over the last 3 years, training and enrolling. It's been 3 years. Does it seem like that?
3 years. It doesn't seem like it's been 3 years, but I really enjoyed it, and I'm glad OIC was a part of it. I mean, I've learned a lot from, working with you guys, so I truly appreciate the opportunity.
I think you are really, OIC is an example of how you reach and create health and wellness, how you reach people, you create their well-being, you help support their well-being. It's more than just having coverage. You said it, Alicia, transportation comes into play. Moms who worry about childcare, who worry about sick kids at home, who are concerned that the lights are going to be turned off. When they get home from school, will there be running water? Sometimes we don't think about that as health, but it is all centered around making sure a person is healthy and well. So
mental health is a big issue right now.
It is.
Mental health is a really big issue. And, more people need assistance with that. And a lot of the individuals in the SOAR program, which is the reentry program, a lot of them need some sort of, mental treatment, whether it's just healing from past traumas so that they can move forward, or, if there is some sort of diagnosed mental issue, Medicaid is there to help them with that.
That's right. I'm glad you said that. One of the panelists earlier mentioned dental care, which was expanded when we expanded Medicaid for adult population. Mental health services is also one of those critical services that is covered through the Medicaid program. And that's really, really important. So I think Linda sent Alicia off to get something that she's going to show us or tell us. But we really appreciate you guys at OIC. Any closing comments, Glenda, Alicia?
Well, I was at my doctor's office, and she gave me this particular card. Let me see. I'm trying to get in front of the camera. And it's for people that can't or don't qualify for SoonerCare or Medicaid. I think you go in there and you fill it out the same way you do for SoonerCare or Medicaid. And it's easier to get the coverage, and it's a $0 plan. I mean, hopefully you can see this. Go a little closer.
And maybe those who are watching can pull that phone out, just hold it for a little bit and get that QR code. We're going to talk with Emma in just a little bit about how other programs, Healthcare.gov, the marketplace, which for the majority of people who take advantage of that coverage, they're not eligible for Medicare, they're not eligible for Medicaid, generally have a zero copay, a zero premium, zero deductible, and also, if not zero, generally less than $10 a month. So it's quite affordable there. We need to take advantage of these programs, but to do that, we have to know. So Glenda, thanks for spreading that word and encouraging people to know about the access to that program. To both of you, thank you so very much. We'll redouble our efforts to make sure that people are healthy and they're well and they're educated. So keep doing what you're doing at OIC, and let's work with some of those people in South Oklahoma, in the southern part of the state, to see if we can get another affiliate. I don't know what it takes, but I'm ready to work. Thank you guys both very much.
Thank you.
Okay, bye, guys.
Bye-bye.
Emma, we sometimes think about healthcare and we think about doctors and nurses and pharmacists and dentists, but we don't think about mental health services as much as we should. So I'm not sure the level of care that Medicaid provides. I know it provides some, and some is better than none for sure. We can access services. And I want to give a plug to our community mental health centers like Red Rock or like Hope or like there's one on NorthCare. So people who need services, I say, and work too hard to make sure that mental health and behavioral health services We're treated just like any other physical health service. The brain is an organ, just like the heart, and we should recognize that and provide for care. So anyway, we've got just a few minutes left. The time has gotten away from us. Emma, I want to ask you a few questions in these last few minutes to talk to us about how we got to where we got. So we've talked a long time about this expansion that occurred through State Question 802. What did the expansion bring to Oklahoma?
So Medicaid expansion was passed by voters in the summer of 2020, and it went into effect in the summer of 2021. And basically what it did was expand our eligibility for Medicaid, which is also known as SoonerCare, as we've talked about today, to include folks who are between the ages of 18 and 64, who do or do not have like dependent children and who make less than a certain income. And that income is 138% of the federal poverty line. Before Medicaid expansion, in order for adults between the ages of 18 to 64 to qualify for Medicaid, they had to have children in the home, and the income limit was much, much lower. And so whenever we expanded Medicaid, many, many, many more people became eligible because of the income limit, and also because of the requirement that you didn't have to have children in the home anymore. So we saw about, if I remember correctly, about 300,000 folks enroll in that program, which was, has been really meaningful for obviously individuals, but also our collective and community well-being in Oklahoma. Because when people have access to that coverage, with 300,000 people getting access to new, comprehensive, affordable coverage, that has rippling effects throughout our families and our communities, and like honestly, the entire state's economy.
That's right, the economy, because somebody got paid for those services and they were not being paid for those services prior to. So it created, I don't want to say wealth, but it certainly created a monetary stream in small communities, rural communities, as well as the urban areas. Do you have any idea that 34% of poverty in real terms for a family of 3 or 4, what that number might be?
Yeah, I should know that off the top of my head. I can look it up real quick.
Well, or just you see that typing, multitasking, and looking it up. I know it's a whole lot, like you said, a lot more than what it was for a single adult to be eligible, or adult with a child even to be eligible for Medicaid.
Yeah, so thankfully, Healthcare Authority has these great numbers on their website. Before someone, like if we did not have Medicaid, then let's say a family of 3, maybe a single parent and 2 kids, the parent to qualify for Medicaid would have had to make less than about $8,000 a year. Very, very low income. Children can qualify at higher levels, but in order for the parent to get it, $8,000. Now, because of expansion, that same 3-person family can make about $34,000 a year and still have access to coverage.
That's substantial.
Yes. that's still, there are many places, probably all places in Oklahoma, where a family of 3 living on $34,000 is not going to meet all of those basic needs. So that's still probably not a livable wage, but it is really great that many more people are eligible for Medicaid expansion to start meeting at least those baseline health and mental health needs.
And we know it's not a livable wage at all, but it does mean a lot more people have access to healthcare services. So then what happens? COVID pandemic came in. There were some things that changed real quickly. Describe what happened to put things on hold, and then talk briefly about why this renewal and this redetermination process is occurring now.
Absolutely. So actually, before Medicaid expansion, the pandemic started. And so in early 2020, the federal government put in place a requirement that basically states would have to maintain Medicaid coverage for everyone who was enrolled on a specific date in early 2020. In exchange for doing that, the state would get, a little bit of extra federal funding to make up for that cost. But basically, the government just wanted to ensure that in this really unstable and kind of scary time where a lot was changing and we didn't really know what was going to happen, that people who were eligible for coverage were able to maintain their coverage throughout that time. So then for the last 3 years since that went into effect, there's been a lot of conversation about how are we going to get out of that and go back to normal Medicaid rules. And so as a part of federal legislation about a year ago, they basically laid out how we were going to phase back into regular Medicaid rules, to where people had to update certain information, keep their information really recent and I guess updated in order to make sure they could keep their coverage. So starting in April of this year, 2023, states, I think all states started in April, they started the transition of unwinding. We've talked about it a lot today, but and that is not unwinding. Oh my goodness, that is not unwinding Medicaid. That is just unwinding the pandemic protections that we had in our Medicaid program. So Medicaid, SoonerCare is still around. There are still many, many people who qualify for SoonerCare. It's just that we're kind of transitioning back to our normal SoonerCare rules. So between April and I believe December of this year, the Healthcare Authority in Oklahoma has been and will continue to go through the process of unwinding. What that means is they're looking at everybody who hasn't gone through their annual redetermination over the last few years, and they're doing that now. They're trying to make sure that each person who's enrolled is still eligible and is still, using the coverage that they're most suited for. And so I think one of the biggest concerns is that a lot of people either maybe moved during the pandemic or maybe don't have access to the same email address, because we all forget our passwords at various times throughout our lives. And so there might be some people who are maybe not receiving all the information about needing to update your information and go through your annual redetermination. Or there might be people who haven't really read any of the notices about Medicaid for the last 3 years because they didn't have to. And so now they're starting to realize, oh, I need to do this. And so we just want to make sure that everybody's getting the notices and understanding the notices and then taking action on those, because we want to make sure that everybody who's eligible is able to maintain their coverage. And those who aren't, we don't want people to just become uninsured. We want people to be transitioning into another type of coverage.
That's absolutely right. And I'm just going to remind everybody, thanks, perfect timing, Annie, to renew your coverage. It's really a simple process that we tried to show you a few moments ago at oklahoma.gov/OHCA/renewals. It's very simple. Click that link. It'll take you right to my page, my benefits page, answer a few questions, and you'll be safe and your family will be safe. We know for a fact, though, that there are some people who may not be eligible. It's been 3 years or so. So you may have gotten a job that now provides health coverage or pays more than the income eligibility, or maybe it doesn't provide health coverage and you still are paid more than the income eligibility. Healthcare.gov, and it's simple as that. Healthcare.gov will take you to the federal marketplace. Emma, can you just kind of describe what that process is?
Yeah, so for folks who think they might be eligible for the marketplace coverage, what that is basically, rather than purchasing your employer or your insurance through your employer or getting insurance through the public Medicaid program, you'd be purchasing your insurance from the private market. And most of the folks who purchase their insurance that way also get subsidies from the federal government to help offset the monthly premium costs. I know insurance can sometimes be confusing. When I moved off my mom's insurance, I had to read everything about 5 times to make sure that I understood. So if you go to healthcare.gov or if you go to try and renew your Medicaid, or if you're just not sure where you can even start, I would really recommend going to the website myokplan.org, calling the number for the healthcare navigators. Their whole job is to help people enroll in coverage, and particularly with something that can be so confusing sometimes because we have such a patchwork system, they can be really helpful in ensuring that you're getting the coverage that's most affordable for you and that meets the needs of you and your family.
That's good. myokplan.org, myokplan.org, a good place to start. There are deadlines for many of these. Again, Emma said that the Healthcare Authority is going to be moving people through the redetermination process between now and the end of December. Go online, make sure you get your dates, your work done there. In case you missed it and they boot you out of the program and you're still eligible, you can come right back into the program. You can also appeal any negative determination that they made. All of that information is on the web. For those of you who think you are going to no longer be eligible for SoonerCare and want to transition to the Marketplace, that is a time-sensitive program. That Marketplace will open up November 1, but it's open immediately if you're no longer eligible for Medicaid, so you can do that right now. But for anybody else who might be listening, November 1 through January 15th, and you got to do it because you can only do that once a year, unless there are certain circumstances that occur in your life. So I'm not going to go into detail, but November 1 through January 15th are critical dates. And just in case you're older, like I am, and you are a Medicare beneficiary, there also is an open enrollment period for Medicare beneficiaries to look at new plans in their area. That period, it's open now, but will close December 7th. So those of us who are over 65 or who have some disability are eligible for Medicare, make sure you take advantage of learning more and choosing the right health coverage for you. So this has been an exciting couple of hours. Any closing remarks, Emma?
I'll just say that I hope folks who might feel confused about what's going on or might feel like you don't know what the next step is, maybe feel a little bit more equipped to take that next step now after all the conversations we've had today. And I just hope everyone, particularly after hearing from so many different people serving so many different populations today, will remember that healthcare is about more than just being able to go to the doctor. It really is about, having access to the medication that you need, having access to healthy food, going to a high quality public school, being in a community where you're safe and you can go outside and all these things. And so healthcare is so important, and so are all the other things that impact our wellness. And I hope folks feel a little bit more equipped to think about those things after today.
I hope so too. I hope they feel equipped to handle that. But you said so many other things impact, like healthy food, transportation. So for our final 2 gift card winners, I didn't forget. So if you, once I call your names, make sure you go to info@okpolicy.org. Marianne Smith of Lawton, you are a winner of a $50 gift card. And our last winner is Annette Myers from Shawnee. Our last 2 winners. So 4 great winners for today. Make sure you share your information, your contact information with us, and we'll be able to get back to you. So as we close, let me simply say thank you for viewing today. For those of you who are watching later on YouTube or Facebook, thank you for watching whenever. We're going to promote this. This is so important. Healthcare is extraordinarily important. I always say it is life or death. We say that about a lot of things, but when we talk about healthcare access, it truly is, for many people, life or death. So Emma, thank you. Annie, Dave, all of our panelists, everybody who's been involved with this production today, all of our on-site live guests at Guiding Right, at OIC, at Great Plains, our good friend Cheryl at Great Plains, thank you. And I am missing, I guess I got everybody. And to Katie, who is out sick today, whose idea this was. I just wanted to send you good wishes and good thoughts and say thank you. So everybody have a great afternoon. Stay safe as the weather changes. And thanks again. Be healthy.